Hey everyone, it's Keith Miller. I hope you enjoyed this throwback episode from the archives of The Soul of Life, which has wrapped production, but I've started a new podcast I'd love for you to check out. It's called Tripping Over Love. You can find it by searching on YouTube or your favorite podcast player today. See you there.
Hey, this is Paul Gilmartin from the Mental Illness Happy Hour, and you are listening to The Soul of Life. And if you happen to turn it off, your life will cease to work. So pay attention. He knows what the fuck he's doing.
I had a career first. I was actually a retail buyer for TJ Maxx. I bought $75 million of Max for the minimum before I turned my attention to studying medicine.
Today on The Soul of Life, I speak with Dr. Lou Lucas, Chief of Palliative Medicine at the Nebraska and Western Iowa Veterans Healthcare Systems. As a palliative medicine physician, Dr. Lucas is trained to pull together all of the specialists that might be caring for a patient with a life-threatening disease and implement a cohesive treatment plan that cares for body, mind, and soul.
And I sometimes think about myself as, witch doctor. I'm sort of 1/3 medical doctor, 1/3 psychologist, and 1/3 spiritual director. And so there aren't that many doctors who can have feet in all those worlds.
We talk especially today about the well-established link between mental health and physical health and the role of spirituality in healing.
Most people have a lived experience of this sense of there's something bigger than I am. I'm part of something. There is more to life than things that you can count and categorize.
I asked Dr. Lucas to explain the mind-body connection and stress, and not just its role in autoimmune disorders like GI problems, arthritis, migraines, nerve damage, and even some cancers, but how to utilize the power of the mind to transform and heal the body.
Some of your immune system is turned down. Some people are probably more susceptible to cancers because their immune system isn't able to nip out those aberrant cells.
And Lou introduces me to a new word she invented about a year ago, Pallia-delic.
Pallia-delic means to relieve suffering by revealing the mind.
Basically, Lou is combining palliative medicine with cutting-edge psychedelic treatments that rapidly accelerate a person's development of peace and acceptance with their identity and gives them lasting mental and emotional flexibility in the face of fear and stress. And finally, Lou affirms something you're familiar with me covering frequently here on The Soul of Life, which is the powerful and life-changing effects, similar in many ways to a psychedelic journey, of using internal family systems, IFS, as a psychotherapeutic and spiritual tool.
I think IFS is one of the most powerful technologies we have at this point to help people work with the things that we've labeled as illness, whether those fall into the category that we've called mental illness or the ways we've called physical illness.
Welcome to The Soul of Life. I'm Keith Miller, and this is episode 11 of season 3, Palliative Medicine, Emotions, Disease, and Self-Leadership.
The little guy with the red face will talk to them. And it's like, I'm sick and tired of you doing this bullshit. Like, oh, that is not a thought that came out of like what they think of as themselves. Like that's something else talking to them. Oh, there is more living inside me than I'm aware of. And I need to find ways to open dialogue with those parts of myself. You are much more internally integrated. You can ride the waves of life because there's more to you than you thought.
If the lights go out or the stars come down, I will always be right here. I don't care if no one else around. I'll hold you down. I'ma always be right here. I'ma be right here. Hey, 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 hey. Yeah, I'ma always be right here. Hey, 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 hey. Yeah, I'ma always be right.
I'm Keith Miller. I bring together people who are interested in slowing down to understand how the mind works and how we can live in greater connection to one another in a fast-paced, stressful world. This is The Soul of Life. Dr. Lou Lucas is the Chief of Palliative Medicine at the VA Nebraska and Western Iowa Health Center. She's also an Associate Professor and Site Director of VA Inpatient Palliative Medicine and Associate Professor of palliative medicine at the University of Nebraska. I'm here today to speak with Dr. Lucas about physicians' health and mental health and their care and quality of life for people with terminal illness. How does a physician take care of themselves, or a healer take care of themselves and prevent or deal with burnout and their own health issues? We'll also speak today about something very interesting called Pallia-delic medicine. So it's great to have you, Dr. Lucas. How are you today?
I'm well, thanks.
I want to kind of ask you if you can describe off the top here what palliative medicine is for the average person that's not a physician.
Sure. Palliative medicine is described as an extra layer of service for people with serious illness. And I think most people have the lived experience, or at least people who have serious illness have the experience of they have lots of people who are focusing on small parts of their body, but not very many people who are putting the whole thing together, who have that special expertise in dealing with illnesses that might be life-threatening. So palliative medicine was born out of the hospice movement when they realized there was a specific need for doctors who are trained in this. So we're trained in excellent communication skills. And I sometimes think about myself as, a witch doctor. I'm sort of 1/3 medical doctor, 1/3 psychologist, and 1/3 spiritual director. We have so little language for it, right? Because most people's perceptions are wrapped up around religion, and they have lots of judgment, good and bad, about religion. And you say, well, no, it's not really about religion. It's about something else.
Right.
And so I think developing language with people about how to talk about these things meaningfully, because I think it impacts healing in huge ways. And I think you shared that, of course.
Yeah, I do. What would you say if you could put your finger on it? What's that something else that you're hoping to bring in?
I have this sense that in our culture in particular, we've really tilted towards the logical, rational parts of ourselves. And there's a lot of reality that is not logical and not rational, and can't be perceived with those terms. And when you try to reduce it to those terms, it sounds corny. But most people have a lived experience of this sense of there's something bigger than I am. I'm part of something. There is more to life than things that you can count and categorize. And so it's that sense of a greater sense of possibility and a greater sense of connection with something meaningful.
Right. Yeah. Connection is an important word, and meaning is important. Those are things that it sounds like you're saying we don't always, if we can't find the answers, we may not be asking the right question.
Right. We're not asking the right questions, and we don't have necessarily the best tools.
Yeah. Yeah. Sounds like it's. Yeah.
And I'm sorry, we've really overvalued this sense of, if I can count it, if I can check it off on a checkbox, if I have a list, if I can do those things, then it's real. But if I can't do those things, then it's something else.
Right. Right. I'm struck by how some of the latest science coming out in neurobiology and the brain, when we think about what a healthy mind is, it's not how smart a person is or how well they test or perform. It's actually how well they tolerate ambiguity or uncertainty. That's a healthy mind.
Absolutely. And the ability to remain creative in the face of stress, the ability to be adaptive. I think that those are things that are really the signs of a strong and healthy mind.
How did you get into this work? What drew you to this? And is there a personality type, if you will, of physicians that would find themselves doing this kind of work versus, I don't know, something that is a little more like, here, take this pill and do this surgical intervention?
Yeah. It's interesting. I don't know I'm sure people have created typologies of the different kinds of people who go into medicine. But there are a group of us who, we peel off the herd at different times in our careers. But you see people who are more holistic, so more looking at the whole person. They are more willing to deal with that ambiguity and not be so locked into, well, if it's not in that textbook, it doesn't exist. A lot of willingness to do your own personal work, because if you're not doing your own personal work, you really can't be in the thick of it with your patients. And what I find interesting is that we have a palliative medicine training program, a fellowship at the University of Nebraska. And we have had Our first fellow is someone who's been practicing for 3 years, and she recognized that the skills that she had weren't enough to do her job in a critical care unit, and that she really needed to come back and do this. And now in our next 2 years, we will have mid-career people who kind of recognize like, oh, this is important work and I need more training in it.
Hmm.
Because a lot of what we do is around language and communication and connection. A lot of people sometimes think that, well, I know how to talk to people, so I know how to do this work. Um, and they don't understand how complex, this, we create reality when we use our words, right? When we're working with people with serious illness, they often don't have the categories and a space to think about what's wrong with them or how they're going to live their lives in this, because they just don't have the experience with it. So you kind of have to talk your way into helping them understand that there's more available to them. And those are really complicated skills. And certainly people who go into the more therapeutically oriented professions, the people who go into counseling, social work, and people who go into psychology have more fluency there. But we don't do a great job of training physicians with those skills.
Right, right. And even in psychology and social work, all the treating field, psychotherapy, you use the term doing your own work. And that's a reference really to having some reflective practice, or maybe having your own counseling, being a patient yourself, right?
Yeah.
In some way.
Yeah. Well, yeah. And thinking of, I think when people see themselves in treatment, they think they are a patient. And if you're a patient, then you're naturally weak. And so you don't want to admit you're in that position. But I find that you just need a thought partner. And you can be doing this for self-growth and really to understand all of your dimensions more fully so that you can be more resilient and more thoughtful and more creative in the face of whatever reality throws at you.
Right, right. And for you personally, what were some of the forks in the road that brought you to this place? Was it always something that you went after in your training?
By the time, well, I'm an atypical medical student because I had a career first. I was actually a retail buyer for TJ Maxx.
Oh, wow.
I bought $75 million of Max for the minimum before I turned my attention to studying medicine. But I grew up in a household that was not particularly healthy. And so by the time I was in my early 20s, I got into my early 20s thinking like, oh, great, I escaped. I'm not an alcoholic. Everything's fine. And then it was like, oh, things are not fine. And I found my way into therapy and really understood how important that was. And so I came into the study of medicine with a personal portfolio of work and knowing what happens to just kids in households that wouldn't look that bad on the outside.
Right.
And what happens to people. And then because I had a career, I worked with people who had serious illness. And so came to it with a little bit more fluency. Then when I was in my medical training, I actually had a semester where I lost a surprising number of people in my life. My father died, 2 uncles, a cousin, and our family dog in the space literally of one academic semester.
Oh my goodness.
And I felt like, I got my thesis in how people deal with serious illness and all the different ways that people dealt with it in our family. And it was interesting because even though I was just a med student at the time, my family turned to me as if I knew what I was doing because people don't know what they're doing in that space, right? When you're a husband or your child or someone is sick, you need a guide. So even at that early part of my career, I was in a place to help guide people through that.
Certainly, you were handed a series of losses that sounded like became your teacher in some way or instructor.
Yeah.
But you also had a natural skill or leadership set that people look to, and even in your family.
Sure. Yeah, it was a tough place, but you get through those things. And if you do it with an open heart, you grow through them.
Right, right. Yeah, you mentioned, well, we're both acquainted with, we're mutually acquainted with Dick Schwartz, the founder of Internal Family Systems Therapy, IFS, which I want to talk with you about because I know that's impacted your life and your career. And IFS, I think I want to give some kind of respect to the disease model that's kind of typical medicine. Like people come in because they're sick, and people seek help because they're stuck with something, and that actually helps. I mean, the disease model, in certain ways, prior to that, we just blamed people for being drunk all the time, instead of saying, no, this is something you're struggling with, and there's a pattern here, and there's a system. We can call it an illness. So coming up with labels was a great innovation for us in medicine, for sure. But also, those labels create problems, right? And one of the innovations of IFS and other mindfulness-based types of practices, and mindfulness is now being introduced at medical schools everywhere, pretty much, is that this idea of dis-ease. It's not a sentence. It's not a box you're in. It's just a state. It's a part of you that's in pain, perhaps, or struggling or overwhelmed. How is IFS? Let's talk about IFS for a little bit, and maybe give people a kind of an overview of what that is first.
Absolutely.
Yeah.
I think IFS is one of the most powerful technologies we have at this point to help people work with the things that we've labeled as illness, whether those fall into the category that we've called mental illness or the ways we've called physical illness. Internal family systems is a therapeutic model and set of techniques that is predicated on the idea that our mind is not monolithic. You don't have a single person who is Lou Lucas, and it's always that same entity. That really our minds are a constellation of little sub-personalities that have their own wants, needs, and desires. And at all times, they're sort of negotiating inside with who gets control of your body and who gets to determine what the actions are and who makes decisions around here. Dick stumbled upon it when he was working with women with eating disorders. And he recognized that the tools that he had as a family systems therapist were not adequate to their needs. I was really lucky in that I had some experience with, there's some different models that look at this idea of the mind being different parts. There's, voice dialogue therapy and Gestalt therapy, and a few things in organizational psychology that deal with this idea. But no one put it together in the way that Dick did, which was to put it in the form of a system and to really see the interrelationships of those parts to each other. And he also helped us understand and bring in this idea of within this model, it's called self. For me, the word soul makes much more sense in that. And the way I've visualized this is sort of, it's a two-dimensional piece where if you think that if you've got a mind, the mind is here in this space-time continuum, and the mind's job is to help you navigate the terrain of the world around you. And so you need a repertoire of lots of different skills to be able to get through that. And if you were the perfect child of a perfect family who had never experienced want or need or trauma, you are sort of born and these roles develop over time and you can navigate the world. But since no human has ever had such an existence, those roles, some of them get damaged along the way, especially little ones. And they continue to carry the energy of an injured child. And just like anybody who's been in a grocery store when a toddler is going off in the cereal aisle and everybody in the 100,000 square foot store knows about it, when you've got that kind of pain or distress in your system, the rest of the system's like, put a lid on that.
Right.
And so other parts of those other parts or roles within your system shift out of the job that they would like to do. And they kind of get the part-time job of finding ways to either shut up that part and cover it up and hide it, or to throw out a hand grenade and throw out something that says, oh no, don't look at this part, look over there. And so those parts aren't available to do their day job. And they're doing some things that maybe they're not the best at. And so you end up with a system that isn't as balanced and isn't as able and adaptive as it could be.
I want to run back to one thing that you said that sounds important when you mentioned soul, Lou, that this idea of self, which IFS refers to as self, is really like a person's soul. It's not something that is it's not something constructed, right? It's not like a concept. It's an actual, like, everyone's born with it. Everyone has it, no matter how they're acting or behaving or how ill they are at that moment. They actually have a fully functioning soul or self that has certain capacities to deal with what you were describing, I think, which are these imbalances.
Absolutely. And, I got excited about my description of the way these parts work together. But what I started out with is this idea that we've got parts that are designed to work with the physical world and help us adapt to different things. They've got different jobs. But there's a different part of us. So if that's that horizontal axis, there's a vertical axis that connects us to, it feels like something else.
Something deeper.
It is something deeper, something more. And it is timeless and placeless. It doesn't have agenda. It's content just with the mere existence.
Right.
And when I was talking earlier about, medicine being tilted towards that logical, what we've tilted away from is this transcendent state that's available in all of us.
Right.
And the mystical traditions get into this a lot, but our scientific and philosophical traditions have virtually ignored it. And so IFS allows us to bring that together.
We know that the body's stress response really can produce symptoms in the body, right? We know this now. I think even as early as, or as late as the 80s, there were still medical journals publishing work that says there's no connection between emotions and disease or illness. But what's your experience with that? How the body can, attack itself and that sort of thing?
Well, it's interesting because the body does two things. Or it can do two things as a result of emotion. One of them is that we know that heightened stress levels produce this, just a flooding of your body with catecholamines, flooding of your body with cortisol, your stress response hormones. And if you're in that milieu for long enough, it dampens down your immune processes. And so some of your immune system is turned down, and that's what makes you more susceptible to, people know that they get a cold after they've finished like a stressful period. Some people are probably more susceptible to cancers because their immune system isn't able to nip out those aberrant cells. But what we see a lot of is on the opposite end are people's immune system that is revved up.
Please take the time now to subscribe to The Soul of Life wherever you're listening. Give it a thumbs up or write a positive review.
But instead, it mistakes. When you're talking about the immune system, the job of the immune system is to know the difference between self and non-self. And it's interesting. I haven't thought about the fact that self is in the middle of that.
Yes.
But it means like the things that are part of your body and the things that are not part of your body. So it knows that a bacteria doesn't belong there. But what happens is that we have a constellation of illnesses that we call autoimmune illnesses or immune moderated illnesses, where often painful and distressing things, and the joints and the gut are the
like
two
rheumatoid
things.
arthritis.
Rheumatoid arthritis and lots of the arthritis entities and lots of things that reside in the gut are closely related to these stressed situations. And if we can modulate that, we can change how the body's perceiving those experiences. And we're probably just at the beginning of understanding how those things really work together and how right now we're hitting the body over the head. We've just developed these immune modulators for rheumatoid arthritis and for some cancers. And I think over time we'll find that we're, like using a sledgehammer, and that we have a lot of these things inside our body, inside our mind, because, our mind controls the nervous system, and the nervous system is connected to every single fiber in your body. And it's the communication pathway. And so if you can change the patterns that your brain is sending down to your body, you can probably change the way your body is responding and the way you experience that.
It's a really hopeful message. I know these two books are beyond the scope of our conversation here, but I would refer people to my interview with Bessel van der Kolk, his book, The Body Keeps the Score. And also Gabor Mate in his book, When the Body Says No, which is really talking about the same thing, the body's ability to recognize self and non-self, and how sometimes caretakers, people, I think they see often there's a correlation between people who are caretakers in their family or professional caretakers and these autoimmune diseases.
Well, interestingly, and migraine as well. And and I don't know if Dick had the opportunity to talk about one of the studies in IFS, but they worked with women who had rheumatoid arthritis. And what they frequently found is exactly what you described. There are women who are caretakers in their family, and the only time they could say no is if they were sick. And this, we find that, people who suffer from migraine disorder, people like, sure, their body has the natural, you have the vasospasm that's causing pain, that you experience as a migraine. But if a part's like, oh, if you go down from that, you don't have to do that party that you were planning on, or you don't have to be part of this event that was going to stress you out, because you now have a good excuse. Here, let me give you that excuse. And I think one of the things that's fascinating about IFS, because first we talked about it being a non-pathologizing model, but I just saw Dick has a new book out called No Bad Parts, and people are really quick to blame the migraines. Like, oh, the migraine's bad, I hate it. Oh, the cancer's bad, I hate it. It's like, what's the cancer trying to teach you? What's the migraine trying to teach you? And when you realize, if you stop and slow it down and you say, this part is just doing the best it can to help make the system work a little bit better. And if you can respect it for, gosh, you're trying so hard. What would you rather be doing than this? How can I help you with this? Then that part can relax a little bit, because it wants to be part of the system. It's just trying. It just is trying with the logic of a 5-year-old or a 7-year-old, which is not enough to get through adult life.
Right. Right. And the first thing that came up for me when you just said that, when you described for people how they would maybe perhaps interact with or begin to have a relationship with cancer, is I would imagine terror. You're telling me I have to get closer to and actually somehow respect, like in a relationship, this thing that I think is trying to kill me. Well, I feel afraid. I want to run away from it.
Yeah, absolutely. And I have a fabulous story of a person that I worked with who had a particularly challenging cancer course. It was one of the cancers that, we don't know what kind of cancer it is. It's so far along, we don't even know where it came from. So it was very serious. And he waded through, we started doing some IFS work, and he waded through several memories that were very challenging, because like you suggested, he had a lot of anxiety around this, wasn't being able to sleep. So we started with that, but we worked down through the protectors that were making him anxious to a point that he was actually able to communicate in a different way with the cancer. He's like, well, what does the cancer want you to know? And he said, that it's smart. It wants me to know that, how talented it is at evading all these things, all of my immune defenses and getting around. And it just wants me to know what it's smart. And it's like, well, what do you think about that? And he said, I can respect that. That's a worthy opponent. And just that sense of coming to terms with this thing that was going on. It didn't feel so much like he was a victim. It felt more like he was in a judo match.
Gives me chills.
Doesn't it?
Oh, it just begins to change. You can feel, I can feel my body responding to that.
Sure. Sure. Yeah. And imagine how it would be if we, of course we don't want the cancer to take your life. Sometimes we don't have any choice in the matter. But so we can use it as a learning experience. But if we caught things earlier, and if we worked with them differently, maybe we could help the body's internal chemistry change its approach.
Right.
And maybe if we did that, we would have more energy available to actually turn down what's going on with the cancer.
Right. Yeah. That's such an important word. It sounds like, Lou, energy.
Yeah.
Is that if you offer, or if you have a way to get me in touch with more hope, and I feel more energy as a result of that, well, energy seems to serve all sorts of purposes in the body.
Sure. And when we have these parts that are in combat with other parts, we call them polarities. You have, one part that's trying to hide and one part that's trying to get attention, and the two of them are at war with each other. That takes up a lot of energy, all in the defense of keeping the system balanced, but it's a lot of energy. And so if you can release that energy from there, then you get the ability for healing. And when you get the healing, you get even more energy.
Yeah. Yeah. Right. I mean, like a typical polarity might be somebody who maybe gets really angry or maybe abuses a substance and then feels really ashamed afterwards and beats themselves up and says, I shouldn't have done that. And I'm a terrible person. And then that brings them, they don't realize it, but that's setting up the next phase of the cycle where now I have to drink to get rid of this shame.
Exactly. It's like, I'm ashamed, I'm going to go hide, and then I'm socially isolated and I feel badly about it. And so now I'm just going to, go get drunk with some friends. Like,
Yeah.
oh, well,
Right.
and then it's like, oh, I got drunk again. And then you go bury yourself, and
Right.
it's that cycle over and over again.
You also used a term when we were speaking earlier, Pallia-delic. Pallia-delic, and that's new to me, but I am familiar with psychedelic-assisted therapy, and that's something of interest for me and many people now. So I'm curious if that's related.
Yeah, so Pallia-delic is new to you because it's new to everyone, because I kind of coined it about a year or two ago. And we actually have a website called Pallia-delic.org. That's the website of our research group. So Pallia-delic means to relieve suffering by revealing the mind.
Mm.
And for me, it's that interface of recognizing humans who are suffering. And in my place, it's people who usually have life-threatening illness. But all of these ways of suffering, people who've experienced trauma, whether it's military trauma, sexual trauma, identity-based traumas, legacy traumas, people who have serious chronic illnesses, people who have addictive disorders, those are all forms of suffering. And I think that we're approaching a place where we have new tools. And the new tools are the psychedelic agents, which seem to be a catalyst or a key inside the human brain and the human mind. What these agents appear to do is relax the mind, and particularly they relax the stories we hold about ourselves. And if these stories, the way you think of, I am Lou Lucas and I am a doctor and I am a this and I am a that, it's like, oh, let's just let that relax. And so this sense of within psychedelic substances, people experience something called ego dissolution, where your ability to hold together your story of who you are just dissolves. And of course, that's a terrifying experience because it feels like you're about to die, or the person you know of yourself. And I think it's interesting from a Christian perspective, like you have to die to yourself to be born again. That there's a sense of that the way you know yourself dies, and in that relaxing, it gives you access to your psyche, to the inner workings of your mind in ways that are not possible without either decades of meditative practice or these agents that exist in nature. We're on the verge of those substances being re-regulated, so we're able to use them medically. I'm involved with it because I'm doing a trial of existential distress in people with inoperable pancreatic cancer.
Wow. That's amazing. I'll refer people also to the episode. I spoke with Dr. Mithofer, and he's wonderful. He's been the lead investigator for the MDMA trials that have been approved by the FDA for the first time. So he's really kind of shepherded that drug's approval through the FDA process. And there's even, and they're very different drugs, but things like ketamine being approved in even like a nasal spray for treatment-resistant depression, and that's Spravato, I believe that's called.
Mm-hmm.
But you're speaking about the dissolution of the ego that is so elusive when we are really kind of in our rigid roles, right? When we are thinking about ourselves, thinking kind of creates this almost it keeps pushing away our ability to get underneath and get curious and really open up ourselves.
Absolutely. When we think we know exactly who we are, we're limiting who we can be.
Right. Right.
I was really lucky to work with a scholar at the University of Michigan named Carl Weick, who was in organizational psychology, and he talked about how people make sense of unexpected events. Why do disasters happen? Why do things happen? And it's often because people can't see the cues that are out there about things that are about to go wrong. And one of the reasons they can't see them or they can't act on them is because of their sense of identity. And the more rigid and narrow your sense of who you are is, the less you're able to see and the less creativity you have in terms of what you can do. But if your personality is more plastic and you're able to see different facets of yourself, um, and define yourself differently. The accountant might not ever do this, but the person who's the mother might be able to do that. So the accountant might never be able to go over and, reach around and hug the person whose, life's been devastated by bankruptcy. But if you think it's like, oh, if I use my maternal energy, then that makes perfect sense for me. And so just that idea of how you can use the different aspects of yourself. And so I came into learning about IFS with this perspective, like, oh, this idea of identity is so different than what, if you have that rigid sense of who you must be to be successful, that's part of our pain.
Mm-hmm. Well, you mentioned earlier that it can be really terrifying to have this experience in what we might consider maybe like a bad trip. But I want to ask you to speak about how different these trials are and how different psychedelic-assisted therapy is compared to somebody just taking a street drug.
Absolutely. Well, they're just so markedly different. And even from the basics of when you're buying something on the street, you don't even have any idea what you're taking or how much you're taking or what you're taking it with or what it's been adulterated with. And so those are first entirely different experiences. Within these scientific settings, first, these are substances that we don't prescribe for people. So this is not like medical marijuana where you say, here, eat an edible every day or something like that. These are experiences that are crafted through the use of these drugs. So you used a term bad trip, and a bad trip can be defined as um, a situation of panic or distress arising from a lack of preparation and support. And so, and that's, you can imagine why that would happen if you took a substance that has the ability to dissolve your ego, if you were, drunk in an unsafe environment with a bunch of people you don't trust.
Yeah.
So that's a predicate for disaster.
Right.
And if I gave somebody a handful of, chemotherapy drugs and said, oh, just take it wherever you want, like you'd have dead people all over the place. So there's a reason that these things are regulated. We put them in the hands of people who are trained for a reason. And other cultures, indigenous cultures, did have a cultural container. They weren't used recreationally; they were used ceremonially and ritually. In our studies, and the way we're approaching it is that this is an experience that we're cultivating, and it comes in three parts. It's set, substance, and setting. So the set is the mindset that you're bringing into it. We ask people to cultivate an intention and to prepare their minds to receive something that is different than they've experienced. There's a setting which is a very safe place that they've been introduced to. It's a living room like setting in most cases. It's very comfortable, and you're supported by the presence of guides who can work with you. And so you go through a period of preparation of several hours at least, but usually over a space of a couple of weeks. You'll meet with people and process and get ready. You'd spend one day in a dosing session, and psilocybin has an active period of about 6 hours.
Mm-hmm.
So we bring people in at 8 a.m. We, kind of get everything ready for an hour. We give somebody a capsule at 9, and they spend 6 hours going through the journey of revealing their minds to themselves. And we've talked about self energy and that sense of there's something bigger, something deeper inside us. And people who work with psychedelics acknowledge a healing energy, that the mind knows where it needs to go. And if you're just willing and able to relax, it will take you to the things that you need to experience. Those things might be terrifying. Those things might be extraordinarily challenging, but those are the things that need healing.
Right.
And if you bring your attention to those things and can allow that to manifest, it loses its energy, it loses its charge and its valence. And so the reason we spend so much work with the preparation and developing the relationship with guides is that we can assure you that without regard to what you believe you are experiencing in your mind, it's all your body and your mind telling you the story that it needs to tell you. Your body's perfectly safe here with us.
Right.
You go and do this work inside, and we'll be there on the other side and to catch you. And when they come out, people are um, um, just amazed at the experiences that they've had. And people can have glorious experiences that are epiphanies and feel like they've met deities and have been resolved. And other people who cry for 6 hours.
Yeah.
And they like, I cried a river. And first it started out as the Platte, and then it turned into the Missouri, and then it was the Nile, and then it was the World River, and I was grieving for the world. It's like, and how do you feel? And I was like, fabulous. And so people have lots of different experiences. But if you go through the clinical work that's been done so far and look in the literature, years after people have had a single experience in one of these clinical experiences, they still say that that's one of the top, either the top or one of the top 5 most important spiritually or personally meaningful experiences of their lives.
Wow. Could you ever imagine a medical program sort of endorsing this as part of like the prerequisite for becoming a healer, a healer that doesn't burn out and
yeah, well, that I don't know if I'm going to live long enough to see that, but it's certainly one of my goals. And I'm sort of in this very unique situation where I knew the people at Hopkins when I lived in Baltimore, and I was actually in one of their healthy volunteer studies, which is how I became personally aware of the power of psychedelics.
So you've had that personal journey.
Right. Yeah. I'm a little bit too old to have made it like into the end of the 60s where everybody was doing it. But I was always aware of it and was very curious about it. And so when I had the opportunity to participate, I jumped on it. But interesting, and I got a lot out of it. It was very meaningful. And about a year after that, I took my IFS level 1 training. And as soon as I got that map, it's like, oh my God. And I could immediately, I'm going to use the term flashback, but I don't mean it in that scary sense. But it was just like, I could see different parts in this journey. It's like, oh, that was this part doing this. And what I saw, and I didn't know how to make sense of, like, oh, those were parts doing this. And so it was just the language and the terrain laid out by IFS made so much sense in terms of that I knew immediately that there was a way to do the work together.
Right. Yeah. I some people have spoken to me about how systematically kind of hypnotic IFS can be, and that there was one person was a hypnotist I interviewed, and he said, "Yeah, you guys are doing hypnosis, and actually you're doing it probably better than us." And that's not a term most of the IFS therapists like myself use, but it is something we often describe as a sort of a moment-by-moment experience. It's not just chatting and kind of strategizing and like problem-solving your life's issues. It's actually asking you to turn your attention inwardly. Yeah. And sometimes people experience that as like mindfulness or meditation, but then we start to interact with what you're seeing, hearing, feeling, and then facilitating those interactions.
Sure. And it's interesting. So I, as a doctor who works with serious illness, I'm doing family meetings constantly. And IFS is just an internal family meeting.
Right.
And I think that for the people who are listening to this who have not had a personal experience with an IFS encounter, it's really, really hard to get it. Because you're just like, what are you guys talking about? And that doesn't make any sense to me. But as soon as you do it, it's amazing to me, because if you can approach these entities that you encounter, it's like, if you just start with where do you feel that that anxiety in your body? It's like, I feel it here. Well, imagine, what does that feel like? It's like, oh, it's like this little kid with his face is all red and his fists are clenched. It's like, how do you feel towards that part? Like, oh, well, I hate it. It's like, well, let the part that hates it step away. Okay, now how do you feel towards it? Like, oh, he looks miserable. It's like, do you feel some compassion towards me? Totally. Like, let him know you feel that compassion. And then and you open this dialogue, and then you ask, like, so what do you want me to know? And well, the most surprising thing that people report is that the little guy with the red face will talk to them. And it's like, I'm sick and tired of you doing this bullshit. Like, oh, oh, and that is not a thought that came out of like what they think of as themselves. Like that's something else talking to them. And when you're able to be in that place of like, oh, there is more living inside me than I'm aware of, and I need to find ways to open dialogue with those parts of myself, then you realize just how rich and complex you are.
Yeah.
And if you can allow those parts to, have their say, they're much more available to you, and you are much more internally integrated than you are otherwise. And then you have a sense that you're better grounded, that you can ride the waves of life because there's more to you than you thought. And if part of you isn't getting what it wants, another part of you maybe is getting what it needs.
Right.
And it really just helps you in so many ways.
I wish everyone could have that experience and not just wait until some life catastrophe like a divorce or a terminal illness or something to bring them to this breaking point of saying, okay, well, I'll open up to something I haven't thought about before.
Well, and that is the conundrum, right? Because we have a world full of people who are just aching, right? Like you watch the news and you've just got people who are just so inflamed and infuriated and
it's a spiritual crisis of the world.
Absolutely. Absolutely. And we reserve these healing modalities for people who are able to self-define and people who have insurance coverage and people who can be part of a clinical trial.
Right. It's a privilege. Yeah. To get this sort of treatment.
Yeah. And when you talk to like Roland Griffiths, who is the scientist who brought a lot of the psychedelic therapies and made them available to us because of his rigorous work he did. I was very excited saying, oh, look, it looks like we're going to be able to use these things for people with cancer. And he's like, but why do we have to wait for people to have cancer? So he talks about using these substances for the betterment of healthy people.
Yeah. Yeah.
Like how do you, it's one thing to take people from below par and bring them up to level. But what if you take people who are level and go like, oh, now I can actually be more loving. Right. Now I can be more open. Now I can be more compassionate. That would do us a lot of good.
It would be amazing. Well, it sounds like you're doing a lot of good, and it's so wonderful to meet you, Dr. Lou Lucas. Would you like to say more about where people can find out about your work or where they can get involved with accessing this kind of care that you're describing for themselves?
Sure. So our team's website is Pallia-delic.org. And there's just a little bit of information about our field in general and the research that we're doing. These days, there's a lot of work about psychedelics, and there's a lot to be found outside. There's an organization called the Hefter Institute that's curated lots of videos of people who are talking about their experience, and I find those are very helpful. The people at the USONA Institute, who are one of the sponsors for psilocybin in terms of becoming a regulated or an appropriately regulated drug, have resources available. And there are just a couple of people doing really good work. That the Aquilino Cancer Center in Maryland is a group who have actually opened a center for healing for cancer patients. And they're doing some clinical trials within their cancer center. They have some new MDMA work available. And there are about 6 of us in the country now who have trials that are either in progress or are about to start. So if you just start looking around, you will start finding them.
That's great. I'll put a link to Pallia-delic.org on the show notes for this, but that is spelled PALLIADELIC.org. Dr. Lou Lucas, thank you so much for being with me today. It's great to meet you.
Thanks so much. It's been great.
Hey, I've started a community for Soul of Life fans interested in talking about episodes or getting more information about some of my teaching on IFS, mindfulness, and relationship growth. Head on over to community.souloflifeshow to get access to this group of really cool people just like you who care about the show and want to talk about episodes or hear more, get access to courses and support each other through life. That's what this is all about. Please leave an iTunes rating for the show and subscribe now wherever you listen to get more soul in your life.
I like it and it's not harsh to my eardrum.
All right, I will go.